now introduce you to our next speaker this morning, and it is my extreme pleasure to introduce you to Dr. Teresa Anderson. And Teresa leads the Single Digit Patient Record Implementation Authority, which is the biggest infrastructure development within New South Wales Health for many years. And she's going to talk to us about how that system is going to be implemented and where and how and when, and how that's also going to impact your lives as users of the New South Wales health system through the next 20, 30 years while we still all live very well lives after stroke. So my pleasure to introduce you to Dr. Teresa Anderson.
Hi everyone, it is so good to be here with everyone today. I will begin by acknowledging the traditional owners of the land on which we're meeting, the Gadigal people of the Great Eora Nation, and pay my respects to elders past, present and emerging. And this artwork actually was done particularly for the Single Digital Patient Record by a wonderful Aboriginal artist called Lee Hampton. And it's not for Aboriginal people, it's for everyone. And it's really about all of the connections between New South Wales Health with our communities, with our staff. And it's really a symbol of the Single Digital Patient Record. And it was really interesting. When Lee did this, it made me automatically think of synapses and connections. And hopefully that's what you see in this. And we think it's really important to have this artwork because the Single Digital Patient Record is not just a technology program. Although it's got lots of technology in it, at its heart it's a human program and it's all about connection. So I would really want to also acknowledge the lived experience of our consumers, of all of you and our community. And it's our discussions with our community, with our patients, that is really helping us to evolve the Single Digital Patient Record to enable it to really achieve what we want to achieve in New South Wales. So the Single Digital Patient Record, it's a big mouthful, isn't it? And what it is, it's our electronic medical record. An electronic medical record is not just like Microsoft Office that you go down to Officeworks and then you plug it in and then it, does a whole heap of smarts in the background. The electronic medical record is like the workhorse of our health service. It's the place that our amazing clinicians write their clinical notes, the progress notes, the history of our patients, and it's a communication tool between our clinicians. It's the place where our clinicians order different tests and diagnoses. It's the place where our clinicians go back to find out what happened to us previously. So I always think of it like the big grunty workhorse that helps our clinicians to do the job they need to do. And the Single Digital Patient Record, as I said, isn't a normal technology program. It really is a health transformation program. It is going to change the way in which care is provided to our patients and to the community. And it will also change the way in which you experience care. Because this is one single digital patient record, it actually has benefits for everyone, for our community at large, and I'll explain that down the track, for our patients individually, and for our clinicians so that they can provide better care. And because it's so big, we're really working with everyone in New South Wales Health, literally everyone across every local health district and specialty network, but very importantly, talking to our community, our consumers, so that we can make sure that this Single Digital Patient Record does what it needs to do. And it really is bringing our whole state together, because if you have one single digital patient record, it actually means for the first time, all of a patient's clinical care within the New South Wales health system will be in one place. And I'm sure you all know what that means. And because we have one single digital patient record, It means that our patients will experience more consistent, safer, and informed healthcare journey. So the Secretary of New South Wales Health said because it is not an IT program, what we do is we need to learn from what we already know. We're not starting from scratch. We already have electronic medical records and we have wonderful services and like our stroke services within all of our districts. And we're not reinventing models of care, we're building them into our new single digital patient record. And we're replacing our current 9 electronic medical records across New South Wales Health. Most of the electronic medical records go across 2 local health districts. So the rest of the local health districts don't have visibility of our records. So if you go to a hospital, Dubbo, and you're on holidays in Sydney and you go to Prince of Wales and you get sick and turn up at the ED, they don't have visibility of your record. They might, if you have a My Health record, have access to some diagnostics that you've had, but they do not have access to your full record. We also have 10 patient administration systems, which is where all your demographic information is held, and we have 5 laboratory management systems. None of them really talk to each other. That isn't because New South Wales Health hasn't tried to do that, but what we've seen, particularly since COVID, is life has changed. Technology has moved forward, and right now, for the first time, we actually have technology big enough to take us, because New South Wales Health is really big. And so what we are creating is a new single digital patient record that brings all of that together in one place. And the single digital patient record will cover all 17 local health districts and specialty health networks, not just 2, all 17, and it will cover all 228 hospitals within New South Wales Health. And when it's fully operational, around about 160,000 of the 180,000 staff we have in New South Wales Health will use the single digital patient record as its main clinical tool to record all of the information about our patients. In addition to that, the current EMRs will be put into a very special archive, and that archive will be available from within the patient's records. So if I go into Kylie's record, in the new single digital patient record, I'll be able to click on a box and it will bring up the archive where all of the legacy, the current EMRs will all be. So we will have everyone's history in that archive available for our clinicians. I'm particularly excited about that. So it will cover, as I said, all 228 hospitals, all our community health centres, 600 community health centres, our pathology collection centres and our pathology lab. The vision for the single digital patient record is all about safety and higher quality care. I'm sure you all know that if all your clinicians have all your information, it means care will be safer. It also means that because it's all in one place, it elevates our relationships with our patients because everybody knows the story of our patients. And leading clinical practices, like the practices that you've heard about today, it will enable much more innovation, and it's a very human-centred system. It's designed for human beings, not for people who are really technologically savvy, because that's not me. And the scope is big, because even in the electronic medical records that we have at the moment, they have different components that don't always talk to each other. The pieces around community health don't always communicate well with the pieces around inpatients, and some of the clinicians who are here with you today will attest that it's hard sometimes to get the information in a timely way to be able to provide care. So the single digital patient record covers ambulatory care, outpatients, it covers inpatient care, specialist care, out of hospital care, our wonderful community health staff, mobility. It actually is mobile enabled, so our clinicians will be able to safely and securely access information regardless of where they are. And as you know, sometimes our clinicians are on call at home and a registrar needs to talk to our doctors or our senior nurses, and they don't necessarily have that information at their fingertips. They will be able to do that now. And it also is integrated with other clinical and non-clinical systems. So all your imaging, our cardiovascular systems, when you go and go to a cath lab, all that information will be linked in to the single digital patient record. So we have it all in one place. And it also has what we call really important analytics. It enables us to analyse the data, look at trends, and identify where we need to provide targeted interventions. It also helps us to monitor our performance and make sure we've got good outcomes for our patients. So if we think about the benefits for all of you, this really makes me very excited, because it means that you will no longer have to recall and remember and repeat health information every time you turn up to a different person. I've just had my husband in hospital not long ago, and he was at a hospital that doesn't have a big electronic medical record, and I had to be his historian constantly because he wasn't well enough to tell everybody. So I had to repeat and repeat and repeat. Have you all been there? Very frustrating, isn't it? But now, once the single digital patient record is in place, no matter where you go, if you go to Royal North Shore, if you go to Dubbo Hospital, your record will all be in one place. And it will also be linked with your My Health record. So information that's in My Health record, the clinicians will be able to pull down with your permission. What that means is, rather than when you're going to see your doctors in your outpatient clinics or your nursing staff or allied health, instead of having to remember when you saw someone, who you saw, and then chase around to try and find that information, they will have it. And therefore your conversation with them will be more about what your needs are, what you want, what your goals are, and therefore you will have a better experience and a more consistent experience. Because if the workflows are the same across the whole of New South Wales Health for one single digital patient record, it means that the care that you get will be the same no matter where you go. And that's what we want, high quality clinical care and people who are all linked up. And it also means that if you need a consultation, you're at Canterbury Hospital and you really need a specialist consultation, the clinicians can ring the specialists, they can all look at the record at the same time, and that way they're communicating about you and your needs in a more easy way. Does that make sense? There's also a really important part of the single digital patient record that I'm particularly excited about. And this is called, it's a consumer portal, a patient-facing application. At the moment it's called MyChart, but it will be called My New South Wales Health. You'll be able to get this little application on your phone. We're going to pilot it in Hunter, New England, and we're piloting it with perinatal and care and the first year of life to make sure we get all the security, everything all sorted out. But the aim is that this will give our patients access to things like their schedule. So you will get all of the appointments that you have with the New South Wales Health System will all be in your MyChart. It'll also have your discharge summary, so you won't have to have pieces of paper everywhere. You can still have the pieces of paper, but you will actually have it in your MyChart. It will have information like diagnostics, etc. Down the track, once we've implemented it across New South Wales, you'll be also able to book your appointments. and they'll send you reminders as well, which will be good. But and we can send you information. So when Kylie and the team are wanting to communicate with you and say, really want you to have a look at this new information that we have, they can send it through MyChart. So that'll make life easier. But that'll take us a while to get there because we've got to test some things. And the things that we need to test are around privacy and security, cyber security. Everyone knows about cyber security. But we're working on that at the moment. So hopefully I'll be able to come back next year and show you some of that. So MyChart isn't the same as My Health Record. As you know, both of them you can opt into. You don't have to use them. You don't have to use My Health Record and you don't have to use MyChart. But the single digital patient record itself, everyone has to use, because if anyone comes to a public hospital, we have to, by law, and because it's the right thing to do, have a record of your care, because that's how we provide safe care. But the consumer portal, the MyChart, is something you can opt into. You don't have to do it. As you know, with MyChart, you opt out. Sorry, with My Health Record, you opt out. With MyChart, you opt in. But the difference with MyChart is you will have information from your New South Wales health clinicians at a deeper level than you would have in MyChart, My Health Record. Does that make sense? For clinicians, this is a game changer. This is something clinicians, any clinicians in the room? Where are they? This is something everyone's wanted for a while. Our clinicians often remember the days we have to run down to radiology and get the images, and we don't have to do that now because they're all in the record. And this is a little bit like that. You know that sometimes when you've turned up to the doctor and you say, well, I saw a doctor at Westmead last year, trying to remember their name. It was in the cardiology department. It was in the neurology department. And then the clinicians have to run around trying to work out who that person was. They won't have to because it will be in the record. And it means they've got real-time access. They have it when they need it. So when they're seeing you, they will have your record and will be able to have that conversation with you. As I said, it's mobile. Oh, I don't know what's happening. It's mobile compatible. I'm going to put this down because maybe that's the problem. It's mobile compatible, so our clinicians after hours will be able to access your record when they're on call from home, and that will make care safer. And it'll also mean there'll be a lot less manual activities for our staff to do. You don't have to read that big slide, but that's there to say there are 59 working groups and councils that are made up of clinicians from across every local health district, every specialty network, every pillar and branch in New South Wales Health. About 700 clinicians and frontline staff every week are helping to configure this single digital patient record. It's the largest big clinical activity that we've ever done. And I have to say, all of you'd be really proud of all of the clinicians and frontline staff that have been involved in this, because their whole aim is to make sure that this single digital patient record is safe and that it's working for all of our patients. So we like principles, so we had some guiding principles around the single digital patient record, and that is, this is a record for everybody, for all of us. This will be my single digital patient record, it will be your single digital patient record, it will be the record of our staff personally as well as clinically. So in New South Wales, this has to meet the needs of all people that we have in New South Wales, regardless of your age, from antenatal to end of life, whenever that might be, and everything in between, all in one place. So it covers adults and paediatric. So you would know that often for young people, when they're transitioning from paediatric to adult services, it's really hard. This will help with that transition and from transition between services. So we're starting in March 2026, and it's really exciting and it's really scary. I find it a little bit scary because it's the biggest program of its type in the world. That's not an exaggeration. So it will be the biggest single instance of an electronic medical record in the world, and we have amazing vendors, software companies that are working with us to make sure that this works and that it is safe. It is hosted in Australia, in New South Wales. One of the things we've been really firm about is that data about our patients can't be taken out of New South Wales. Very important. So the single digital patient record starts implementation in March 2026, and we have 5 tranches or stages, with the last one in 2028. So it's a very ambitious program, and we will meet those timelines. So the first go live is in Hunter, New England, Justice Health and Forensic Mental Health, and New South Wales Pathology. And we've been doing a lot of work to configure the single digital patient record. As I said, it's not like Officeworks that you might have on your computer, where you basically buy it and then plug it in. We have had to configure it to make sure that it meets New South Wales health workflows, the workflows of our clinicians. As you know, Kylie is on the state ACI network, stroke network. They've done a huge amount of work over a long time about stroke models of care. We're not reinventing them. We're building them into the single digital patient record, using the expertise of all of our staff. And there's a lot of work going into training of our staff in the new single digital patient record, but we're not training them to be clinicians. They're already amazing clinicians. What we're training them to do is to use the single digital patient record to be able to do their work the best way they possibly can. We've done a lot of work in Aboriginal health in particular, and one of our issues with Aboriginal health is people are really scared that the record will just perpetuate racism. And we've done a lot of work to make sure that people are really confident. But we've also worked with our CALD communities, our communities that have a disability, and our communities that are very vulnerable. And the reason for that is this has to be a record where everyone feels safe and everyone trusts it. So we've got some particular functionality in the single digital patient record that have required some pretty big decisions to make sure you're all confident in this single digital patient record. I've talked about My Chart. My Chart is wonderful, and you can actually give people proxies. So my brother, once it's fully rolled out, and I have My Chart, my brother could make me his proxy because I'm already the person who navigates his care, who makes arrangements for him to see different people. So he can make me his proxy. And that's really terrific while we have a really good relationship. But what happens if our relationship broke down? We've got to make sure we've got controls so that he can say, no, I don't want her to have it anymore, or that only the right people have it. So there's some things we've got to do to test to make sure, again, you all feel confident in this single digital patient record. There's another really important functionality called EpiCare Link. You don't have to remember the title, but it is a provider portal that enables other clinicians, not part of New South Wales Health, to access information from your electronic medical record. But we've designed it so that that can only happen with your express consent. And you can consent for this moment in time, or for 3 months, or ongoing until you turn it off. And we're testing all of that to make sure it works. So we're starting again small with about 4 GP practices in Hunter, New England, to make sure that that works for them. But most importantly, to make sure it works for you, because we want it to be safe. And all of those GPs and other services will have to sign a contract to say they will meet all these obligations around privacy, data governance, cybersecurity, making sure that people don't put their passwords on the fridge, for example. So we've done what we call privacy and security assurance on the single digital patient record, because every group of consumers, every community group I talk to, every patient group I talk to, number one job is making sure it's safe and that we've covered off cybersecurity, because everyone hears about cybersecurity. Someone, when I took this job, said to me, "Have you thought about cybersecurity, Teresa?" I went, "Yes." There's a big part of this about making sure you all feel safe with this record and that nobody inappropriately is accessing your record. So we've got a big data governance arm in relation to the single digital patient record. So I just wanted to show you what it looks like. You don't have to use this bit, but for the clinicians in the room, maybe you won't see it. Oh, so that's when you log in. And everyone, when they log in, it's all password protected and very secure, and only every clinician has their unique identifier. So we will be able to audit who went into the record, when they went in it, if they changed anything, and we will run regular reports to make sure people are using it in the right way. That's what it looks like. It looks pretty beautiful, if you ask me. You don't have to read all of the bits. But one of the things that's wonderful is down the left-hand side, it has a thing called the storyboard. And that storyboard is a little bit of a summary about our patients. And it has special things on it that include, if you are participating in a clinical trial, then it means everybody knows you're on that clinical trial, and they can make sure that if you turned up at an emergency department and you were having a reaction to something, we would know that it could be a reaction to the clinical trial that you're having, for example. But it's a very simple single digital patient record compared to what we currently have. It'll be very easy for our clinicians, and what makes things easier for our clinicians means it makes it easier for them to provide the fabulous care that they do. So that's it for me. Hopefully, I might be able to come back next year and show you where we're at, particularly in relation to the MyChart, the patient-facing portal. But we are very excited about this. As I said, it's very scary for me because I've got to make sure I hit all my time frames. But the opportunities that we have with this single digital patient record to improve communication between all of our staff, to enable them to do proper care planning with all of you and meeting your goals is what makes me really excited. So I'm really pleased to have been able to come and share this with you today. So thank you.